Also covering Colorado First tonight with new information on the fentanyl crisis. New numbers from the state show a rapid increase in deaths, and many victims had no idea they were even taking the dangerous synthetic opioid. From 2019 to 2020, just 1 year, Colorado saw a 54% increase in opioid-related deaths. 540 of those involve fentanyl. And preliminary data from last year shows a 66% increase in deaths, with 896 related to fentanyl. Law enforcement talked about the crisis today as lawmakers work on a bill that could help.
We're not talking about 55-year-old, multi-decade drug addicts. We're talking about kids who make mistakes. It's almost the definition of youth, is to do dumb things. We've all been there. But we are living in a world right now where kids they get one chance.
State lawmakers are considering a bill that would increase penalties for possessing fentanyl. There will be a committee hearing on that next week.
Well, Jim, while the spotlight on fentanyl is relatively new, the opioid crisis has been a subject of new laws and regulations for years now. The focus right now is on those counterfeit pills that are flooding the streets. But for those who rely on prescribed medications, they are fearful that they cannot get what they need. Karen Morfitt has been leading our coverage at 10 on this crisis for us. Karen, you spoke with some chronic pain patients.
And Karen, they say it's already hard to find a doctor who will prescribe opioids for their pain. We also talked to state influencers who are trying to combat abuse of prescription drugs. They say they're trying to stop what's known as the medicine cabinet problem, where leftover opioids become a problem and are left over in your medicine cabinet. But they're trying to change law with those chronic pain patients in mind.
For Carly Haynes, managing pain has been a lifelong and daily struggle.
I was diagnosed in 2015 with Chiari malformation. So my brain is too big for my skull and it herniates down into my spinal column.
That's in addition to a disorder that slows her ability to heal.
I am prescribed oxycodone, the lowest dose possible.
Getting to this point, she says, has been equally as painful given the strict requirements around opioid treatment.
When you do see a new doctor or I have to see a new specialist, there's already that judgment right away that you're just an addict, you're seeking medication.
Robert Valek, director of the Center for Prescription Drug Abuse Prevention at University of Colorado, helped implement Colorado-specific policies.
So we're trying to have this balance that we're striking, but it's very important that we preserve access for those with legitimate medical need.
He points to the development of our prescription drug monitoring program designed to do just that.
It's meant to identify someone who is a drug seeking, but also to reassure the doctor that they're looking there, oh, you're clearly not drug seeking because I'm the only person you're coming to.
For Haynes, the worry is that more requirements may be coming and will only push more doctors away.
I've seen numerous stories where people can't get access to prescription pain medication and they turn to alcohol, or they do turn to the streets.
Now, Haynes says in order to continue her pain management plan that does include opioids, she not only has to meet with her doctor every time she needs a prescription refilled, but she also has to take a required once-a-month class on pain management. In Thornton tonight, Karen Morfitt covering Colorado First.